Imagine going to the doctor because you feel anxious and depressed, but before you can even explain all your symptoms, you're handed a prescription and sent on your way. This is the reality for many Americans today. While medication can be life-saving for many, doctors should be required to present therapy and lifestyle-based treatments before, such as counseling, exercise, and stress management, before prescribing medication. Mental health affects everyone, whether it's someone we know or personally. Understanding all the types of treatment is important for each individual well-being. Today we'll be looking at the issues with the way mental health is approached, explore the main causes for over-reliance on medication, and consider solutions that put patients in control for choosing their form of treatment. Let's begin by defining the problem with how mental health is often approached. Many doctors prescribe medication for anxiety and depression before presenting therapy and lifestyle-based options. According to Monica Kim in The Atlantic in 2021, nearly 80% of antidepressant prescriptions in the U.S. are written by primary care doctors, not mental health specialists. Patients are often unaware of evidence-based alternatives, leaving them with limited choices in managing their mental health. Over-reliance on medication creates long-term concerns about side effects and dependency. Now that we've seen the problem, let's turn to what causes this over-reliance on medication. The medical system and cultural attitudes contribute to prioritizing medication over holistic treatments. Psychiatrist Alan Francis explained in a 2020 article from Psychology Today that time-pressed doctors often find prescribing medication faster than explaining therapy or lifestyle approaches. Insurance companies typically cover medication more readily than therapy, making non-medication treatments less accessible. A stigma surrounding therapy discourages many patients from seeking counseling compared to a quick fix medication. Now that we know the causes behind this issue, let's look at some effective solutions. Doctors should be required to present therapy and lifestyle options before prescribing medication. Cognitive behavioral therapy is an effective form of therapy for someone with mild to moderate depression, and might even be more, if not just effective as medication. For this chart, what treatments work for anxiety? In blue, it's cognitive behavioral therapy, red is medication, and yellow is traditional talk therapy. As you can see, the blue is higher than most of the medication. So 90% for panic and phobia is cognitive behavioral therapy, and this shows that it can be more beneficial than medication. In 2022, Deborah Blackwell explained in Harvard Health Publishing that lifestyle changes such as regular exercise and mindfulness practices can reduce symptoms of anxiety and depression with no harmful side effects. Requiring doctors to present these alternatives empowers patients to make informed choices about their mental health. Now let's wrap things up by remembering that while medication is important, patients deserve the chance to consider therapy and lifestyle options first. Medication will always play an important role in treating mental health conditions, but patients deserve the chance to consider therapy and lifestyle options before any decisions are made. We saw how the current system often prioritizes medication over other effective treatments, examined the systemic and cultural reasons this happens, and explored how requiring doctors to discuss therapy and lifestyle alternatives can lead to more informed and personalized care. The next time you or someone you care about seeks care for help for anxiety or depression, ask about therapy, exercise, or mindfulness before automatically turning to medication. By pushing for a more balanced approach, we can change the way mental health is being treated with one informed choice at a time. Thank you.